Hey everyone, Dr. Mike here, coming to you this afternoon to talk to you a little bit about back surgery, believe it or not, and when it's appropriate, because there are cases where it's appropriate. I have been in practice 29 years, and I have had patients where I actually sent them to a neurosurgeon because after we did an MRI, we found findings on it that showed that they probably should see somebody and get it taken care of. Most cases, 98% of backs are not surgical. And that comes from the top, that doesn't come from me. It comes from the top neurosurgeons in the world. What they say is if the disc is completely blown where there's fragments floating around in the canal, that's the time that the disc is surgical, because you have to go in and repair that or you start seeing major neurological symptoms like loss of bowel and bladder control and things of that nature. Most disc bulges or disc herniations are not surgical. Can you find somebody to do surgery on them? Of course you can. You could walk down the street with not even having a disc bulge and probably find somebody to do surgery on your back if you wanted to, if you searched hard enough. And I don't think the search would be that hard either. Most cases are doing surgery on things. We found that more conservative care is the appropriate thing that they should be trying. Chiropractic care, physical therapy, exercise, things of that nature. And if the patient's willing to go through that and willing to do those things and willing to give it a chance, even with severe herniations, we see improvement and we see problems go away on their own. One of the early cases when I had just started my practice, I had a new patient that was scheduled for back surgery in less than a month. I took a look at his MRI and he had a pretty significant herniation in there, but I told him to give me a month. Let's see if we can get it better. Let's see if we can keep him out of surgery. Well, 30 years ago, he still hasn't had surgery today. He's still a patient of mine. I remember going down to the office at 2 o'clock in the morning when he had an acute flare-up and adjusting him and taking care of him and really doing the things that we needed to do. And he was very diligent about making his appointments. And like I said, that was 30 years ago, and he still has yet to have back surgery, and he still comes in here and gets adjusted to make sure that he's doing well. So most cases aren't surgical. If the disc is completely blown, they are surgical. And I've had 3 of those in my career that I've had to send out. So out of all the thousands and thousands of patients that I've seen, really 3 were absolutely surgical that they needed to go get it taken care of. Other than that, if you're diligent and you understand it's going to take some time, we can get you feeling better. So try conservative care first. You can't undo surgery, and back surgeries are no cup of tea. There's still no guarantees you're not going to be worse off after the back surgery. So just wanted to get that out there. Wanted to let you know that if you have back pain, if you're suffering, you have a disc bulge or disc herniation, don't freak out. In most cases, those are not surgical. Have a great day, guys.